cyfarfod llawn. Cyn I ni ddechrau, dwi eisiau nodi ychydig o bwyntiau. Mae cyfarfod llawn a Cynhelir drwy gynhadledd fideo yn unol ar rheolau sefydlog Senedd Cymru yn gyfystyr y thrafodion y Senedd at ddibenion deddf Llywodraeth Cymru 2006. Bydd rhai o ddarpariaethau rheol sefydlog 34 yn gymwys ar gyfer y cyfarfod llawn heddi, a mae'r rheini wedi nodi ar yr agenda chi. A dwi eisiau atgoffa'r aelodau fod y rheolau sefydlog sy'n ymwneud â threfn yn y cyfarfodydd llawn yn berthnasol i'r cyfarfod yma ac yr un mor berthnasol i aelodau sydd yn y siambr a rhai sy'n ymuno drwy gyswllt fideo. Ac felly, i gychwyn, dwi eisiau hysbysebu'r Senedd yn unol â rheol sefydlog 26.75 fod deddf anifeiliaid gwyllt a syrcasau Cymru 2020 wedi cael y cydsyniad brenhinol ar y 7 o Fedi. Yr eitem gyntaf prynawn yma felly yw'r cwestiynau i'r Prif Weinidog, ac mae'r cwestiwn cyntaf gan John Griffiths.
Diolch, Llywydd. What action will the Welsh Government take to protect the most vulnerable in society during the COVID-19 pandemic?
Llywydd, an enormous effort has been mobilised across Wales to protect our most vulnerable citizens during the pandemic. In addition to our public services and third sector organisations, countless volunteers, friends and neighbours have provided help to those most in need. Our Winter Protection Plan published today sets out ways in which this huge collective effort can be continued.
First Minister, COVID-19 has laid bare the indefensible unfairness in our society. Those on lower incomes, in insecure jobs, living in poor quality housing and suffering health inequalities are particularly vulnerable to the virus in terms of their health, economically and socially. Our more deprived communities, black and ethnic minorities and disabled people are disproportionately affected. In Newport, we have experience of this, and we now have a worrying spike in COVID-19 cases. First Minister, will you set out the Welsh Government's response to this recent outbreak and join me in urging local people and businesses to redouble their efforts to follow regulations and advice to keep the virus under control and avoid further lockdown?
Llywydd, I thank John Griffiths for those very important points. He quite rightly draws attention to the recent spike in numbers of people suffering from coronavirus in the Newport area. A considerable effort is being mobilised through the local outbreak control team, working very closely with the local authority. I was speaking with the leader of Newport Council, Councillor Jane Mudd, yesterday. And our Test, Trace, Protect team have been absolutely assiduous in following up all those cases that have come to our attention and then in turn getting in contact with the people that they have been in contact with. As a result, those efforts are helping to stabilise the position in Newport, and of course we hope that there will be no need for further action, but if there is a need, if those figures do not improve and local action has to be supplemented by national action, then that is exactly what will happen. And as John Griffiths said, Llywydd, that is even more important for those vulnerable groups in a city like Newport, black and minority ethnic communities, people with disabilities and so on, for whom, were the virus to get out of control, the risks would be particularly serious.
Angela Burns.
Diolch, Llywydd. Good afternoon, First Minister. I listened to your response to John Griffiths very carefully because I agree that there's a lot of harm to be done if this virus gets out of control. There's also a significant harm that will happen to people who may be asked to shield again, to people who have such disabilities, to people who've got perhaps learning disabilities, do not understand clearly what is going on. So for an example, I've been approached by a disability advocacy group where one mother's daughter, who's in a residential setting supported by social services, has been told that she probably will not be allowed to go home until June of next year. Next year. We are asking some people to make absolutely extraordinary sacrifices. If we do have to go back into lockdown, those who have to shield will have to go back into it. First Minister, what assurances could you give us, or what can the government do to make sure that this time around, if we are faced with that situation, there are ways we can be more compassionate and more kind about some of the things we're asking some of the very vulnerable people in our society to cope with, especially those who perhaps have it more difficulty in understanding the necessity?
Well, so thank the member for those points, and I agree with very much of what she said, that the impact of responding to coronavirus falls especially hard on those people who have the least ability to be able to recognise what is happening around them and then to respond to it, whether that be very elderly, people who have suffered from dementia, whether it be people with learning disabilities and so on. And it is very important that we learn from the experience of the last 6 months. My colleague Jane Hutt has chaired 5 meetings of the Disability Equality Forum over that period, been attended as well by the Chief Medical Officer and by my colleague Julie James. And all that is about trying to learn from the lived experience of people who, as in Angela Burns's contacts cases, have had to live with the astonishing burden that coronavirus has placed on some members of our society. So I think the best assurance we can give those people is to listen carefully to them and to hear from them about ways in which, were we to face a further period of the sort we faced back in March and April, that we have learnt from the ways in which they have coped with this experience and where we can do more to support them and can design our public services in a way that is better able to respond to their needs, then that is exactly what we will try to do.
Cwestiwn 2, Michelle Brown.
Thank you. What assessment has been made of the risks to public finances as a consequence of the COVID-19 pandemic?
So, the Office for Budget Responsibility's latest assessment shows a very large increase in the fiscal deficit for the UK as a whole during this financial year. The Welsh Government's fiscal framework protects the Welsh budget from the impact on devolved revenues of the UK-wide economic shock arising from the pandemic.
Thank you for that answer, First Minister. Your government has encouraged local authorities to invest in commercial properties around the country. You have lent them taxpayers' money to do so, and the Development Bank Wales lends money directly to private companies developing commercial properties. Last financial year, the bank lent £34.1 million of taxpayers' money to property developers, and this year the bank has 2 funds available to property developers totalling £97 million. Most of it is in the Commercial Property Fund, and all of the money is provided by the Welsh Government, i.e. the taxpayer. As a result of lockdown, property experts are predicting that commercial property could lose 50% of its value, and rent returns will go through the floor as businesses close, downsize offices because more staff are working from home or need rent holidays. Even the Office for Budget Responsibility admits to at least a 14% drop in value over the next year. If the OBR are correct, the Development Bank Wales could lose £7.7 million in 1 year if it invested all of its commercial property fund of £55 million. The bank may already have lost £4.7 million on last year's investments. The picture could be just as bad for local authorities. Flintshire County Council, for example, owns 13 business centres and industrial estates. So how much taxpayers' money invested in commercial property could be lost due to lockdown? How much money have you set aside to bail out councils who lose money because of investments in commercial property reducing? And has the DBW changed its lending criteria towards commercial property developers since the coronavirus came along and changed the way people work and conduct business?
Well, so I think the risk in the member's question is to conflate short-term and long-term consequences of the pandemic. In the short run, there's absolutely no doubt at all that commercial property values have been affected by coronavirus and that they will continue to be affected as the economic shock of the pandemic unfolds across our economy. But I don't think that we should assume that those short-term impacts are guaranteed to be characteristic of the way the economy will recover. Nor do I think it is fair to criticise any organisation from having made lending decisions in one set of circumstances, when something entirely unforeseeable then makes a difference to the way that those investments are now valued. What I expect to see is I expect lending decisions now to be calibrated to the current set of circumstances we see, and I expect us to take a long-term view of some of those investments and not to make decisions in haste that would respond to what we all surely hope is a temporary impact of a global set of circumstances on our economy, and that the economy will recover in ways that will protect those investments in the longer term.
Nick Ramsey.
I think Michelle Brown just about covered everything there, didn't she, First Minister? But I'll ask you about tax situation. Yesterday in Finance Committee, the Finance Minister gave us, we had an evidence session with the Finance Minister where she spoke about the impact of the pandemic on house sales and on land transaction tax. What assessment has been made of the ongoing pandemic on not just that tax but on all taxes, including the Welsh rate of income tax? And you just mentioned in response to Michelle Brown that the fiscal framework supports the Welsh budget against shocks such as a pandemic and UK and international shocks. Are you confident that the fiscal framework is operating properly and it will fully defend the Welsh budget and Welsh tax revenues against the shock of the pandemic?
Well, Llywydd, if I was to take Nick Ramsey's phrase literally, fully defend, then I don't suppose I could guarantee that, because the impact of coronavirus will be felt across the whole of the UK economy, as well as the Welsh economy and across UK government revenues, as well as our own. I am confident that the fiscal framework defends us against shocks that would be experienced in Wales, where those shocks are experienced elsewhere. The block grant adjustment will take account of that and will mean that we are protected against those effects. I'm also pleased to be able to say to the member, because I know what a close interest he took in it at the time, that the 105% consequential rule that we have as a result of the fiscal framework has already provided £360 million to Wales that would not have come to Wales were it not for the fiscal framework, and that part of it that we negotiated at the time. So we are defended by the fiscal framework. None of us are defended against the global impact that coronavirus has on the whole of the UK economy and more widely.
Vicky Howells.
Diolch, Llywydd. First Minister, I'm confident that you will agree with me when I say that an innovative use of tax competencies can have a positive effect on our public finances, as well as bringing other positive societal benefits. As you'll know, I'm a keen supporter of the vacant land tax, which could not only boost public finances, but more importantly also transform our communities. So I was disappointed to read the written statement from the Finance Minister last week about the foot dragging from UK ministers on this. Will the Welsh Government continue to press UK ministers to respect the devolution settlement so that these proposals can be developed and not let them use responding to the pandemic as an excuse for inaction or rowing back?
Llywydd, thank Vicky Howells for that, and I very much recognise the interest she has taken in the vacant land tax issue. Well, remember the short debate that she held on this topic. Sadly, this is a much less positive aspect of our negotiations with the Treasury. While I was able to speak positively of the fiscal framework, this is a much less satisfactory story. Let's remember for a moment, Llywydd, that what we have been trying to do is to use a power put into the Conservative 2017 Government of Wales Act. This is a power that the then government put on the statute book, and it allows the Welsh Government to propose new taxes for Wales. Some members here will remember that we deliberately chose a narrow and specific tax, a vacant land tax, not a controversial tax in many ways in principle, in order to test that machinery. And more than 2.5 years have gone by since that proposal was first put to the Treasury. And despite what have been, some points been, reasonably productive relationships, in August we received a very disappointing letter from the Chief Secretary, the Exchequer Secretary, to the Treasury, reopening a whole series of questions and debates which had already been answered in previous negotiations. I'm afraid what is becoming apparent is that the machinery that we set out to test is not satisfactory, that it is not competent to deal with the issue that the previous Conservative government itself put on the statute book for Wales. We'll continue to work away at it, as Vicky Howells has said, but I'm afraid what we're learning is that the machinery itself is broken beyond repair.
Cwestiynau nawr gan arweinwyr y pleidiau, arweinydd y ceidwadwyr Paul Davies.
Diolch, Llywydd. First Minister, yesterday it came to light that Public Health Wales admitted a data breach that saw details of just over 18,000 people who tested positive for COVID-19 posted on its website for almost a whole day. That figure included almost 2,000 people living in communal settings such as nursing homes and those living in supported housing, which went as far as to reveal their place of residence. First Minister, given that this is not the first time there has been a problem with public health data, it's deeply worrying that the Health Minister didn't come forward with this immediately and with an explanation on what steps will now be taken to restore public confidence, because it's been suggested that the government has known about this for weeks. So, First Minister, I hope you'll now take the opportunity today to apologise to the people affected by this latest data breach. And will you also take the opportunity to tell us how long the Welsh Government has known about this breach and what you're doing to restore public confidence in its data management?
Well, Llywydd, I learned of this data breach yesterday. And I learned of it as a result of Public Health Wales' statement, which, as Paul Davies has said, drew attention to the data breach. It is a serious matter when data regulations are not properly observed. And I think Public Health Wales was right to apologise to those people whose data was inadvertently put into the public domain in this way. Thankfully, as Paul Davies said, the breach lasted for less than a day, and the initial inquiries suggest that no harm has been done as a result. But that is a matter of luck rather than anything else. It's right, therefore, that Public Health Wales has instituted an inquiry into what went wrong, has informed the Information Commissioner, and we will look to both of those offices to make sure that the reasons that lie behind the data breach can be identified, and if there are any systems that need to be put right, that those steps are taken rapidly.
Well, I'm sure, First Minister, the people affected would appreciate an apology from you as First Minister, given that these circumstances have taken place. But, of course, this isn't the first personal data breach following the incident where 13,000 shielding letters were sent to the wrong addresses earlier this year, not once, but of course twice. And let's also not forget that Betsy Cadwaladr University Health Board, under your direct control, First Minister, failed to report daily coronavirus death figures because it used a different reporting system to one set up for the Welsh NHS. Therefore, let's hope this is the last time people's personal data is mishandled during this pandemic, as this could very well damage public confidence, particularly as people are being asked to hand over personal details for the track and trace system. First Minister, there's also understandable concern at plans to reduce COVID-19 testing from weekly to fortnightly at care homes in North Wales. Can you therefore confirm that the Welsh Government will not reduce the weekly testing of care home residents in Wales? And can you tell us what discussions the Welsh Government is having with those in the Welsh care sector about its testing programme?
Well, so it's important to correct a number of points in that. Let's be clear that Betsy Cadwaladra's use of a different reporting system did not involve any breaches of personal data. The two things are entirely different. And then they're not connected in the way that the member attempted to connect them in his follow-up question. Nor are care home residents tested. It's care home staff who are tested on a weekly or a fortnightly basis, not residents. So let's be clear about that too. It is quite important in this to be accurate in the way that we put these questions and discuss them. So we are in discussions, of course, with all local health bodies about the rate at which we test staff, and where there are symptomatic residents, that residents are tested as well. The positivity rate of staff tested in Welsh care homes over this summer was 0.12%. It was absolutely fractional. And it's important to be proportionate, as I believe your Health Secretary, Matt Hancock, has been preaching all morning, about the way we use the scarce resource that tests represent. The difficulties that we face in care home testing in Wales are because we switched care home testing to the lighthouse laboratories provided by the UK government. And, you know, I'm sorry that some care homes are losing confidence in that system and suggesting they wouldn't be prepared to take part in it. We will look to see whether we need to switch capacity back into the Welsh system in what I hope will be a short period, while those lighthouse labs return to the very good service that they were providing in Wales as elsewhere only 3 weeks ago. But the temporary difficulties in care home testing, such as they are as a result of the difficulties that that system, that UK system, is experiencing, not because of difficulties in the Welsh testing system.
Yeah, the point I was making, First Minister, it is important that you as a government consult with the care home sector, because it's absolutely critical that the sector is being fully consulted on your testing policy, and I hope that you will reflect on your comments. Now, one aspect of testing policy that could make a real difference in identifying possible threats is airport testing. Testing all people returning home from abroad will surely keep people safe. Now, the Shadow Home Secretary, Nick Thomas-Simmons, called for a robust testing regime in airports as a way to minimise the need for the 2-week isolation period upon return to the UK. And in a letter to the Home Secretary, he made it clear that ramped-up testing is an important part of trying to respond to the pandemic and safely reopen society. He also said, given the huge challenges being faced by the travel sector and the scale of job losses, it makes sense to look at this area as part of a wider package of improvements to the testing regime. The Shadow Home Secretary is right. I agree with him. Do you agree with him?
Well, so we are in discussions with the airport in Cardiff to see if we can find a practical way in which airport testing itself could be carried out. There are some practical issues that have to be addressed in that, in terms of the length of time that people may have to wait at an airport, how long people would be prepared to wait at an airport. You can't require people to do these things. It's a matter of voluntary participation. Therefore, you have to spend a bit of time to make sure that if you are able to provide tests at an airport, you can do it in a way that is effective. And those discussions with the airport authorities here in Cardiff are continuing.
Arweinydd Plaid Cymru, Adam Price.
Diolch yn fawr, Llywydd. BMA Cymru Wales has warned that a second COVID peak is highly likely this winter and is the #1 concern among the medical profession, as it is, I'm sure, for all of us. Could I urge the First Minister to give serious consideration to adopting elements of the 10-point winter plan that we published today, which is designed to avoid both a second wave and a second national lockdown? In particular, could I ask that the First Minister examines the case for introducing, wherever possible, a targeted approach adopted by some countries based around smart lockdowns focused on high infection spikes at a community or neighbourhood level rather than lockdowns across a whole local authority area?
Well, thank you, Adam Price, for that question, Llywydd, and I'm looking forward to having a chance to look properly at the 10-point plan. Any constructive contribution to ways in which we can better approach the winter are welcome, and I know that he will have seen the winter protection plan that the Welsh Government has published today, and there's a lot of overlap between the ideas. So I'm very keen to look constructively at those ideas. In many ways, the idea of a smart or targeted approach can be seen in the way in which our TTP system responded, for example, to the Rowan Foods outbreak in Anglesey, in Wrexham. where we didn't need to have borough-wide restrictions on people's liberties. We were able to focus on the people who worked at that plant and their immediate contacts. The requirement to self-isolate, the advice that was given to that particular group in the population could be, I think, fairly regarded as an example of a smart lockdown, as those people were in isolation for 14 days. And the more we are able to target our interventions so that they respond to the nature of the problem we have in front of us and don't restrict, therefore, the lives of people who are not directly caught up in that, the better I think we will command public confidence when those measures need to be taken.
The forecasting team at the London School of Tropical Health and Medicine are reporting currently their estimate as of the 11th of September of the R figure for Wales as being 1.43, which would put Wales as having the highest rate of growth currently in the UK, and a doubling time of just over six days. Do you recognise those estimates, First Minister? And if not, what are the Welsh Government's latest estimates? And given the growing urgency of the situation and the difficulties that you referred to earlier in terms of the UK Lighthouse Lab system, is it possible to bring that new network of hot lab facilities being planned in Wales on stream earlier than November? And as capacity grows, can we look at testing asymptomatic contacts, as many countries, including the United States, have now begun to do?
Thank Adam Price again for those questions. The tax summary published, I think, today suggests that the R level in Wales is above 1. I don't think we would sign up to a figure as precise as 1.43. The problem with the R figure for the whole of Wales is that it is inevitably affected by the southeast corner of Wales, where we have seen such spikes in the last week or so. There are whole parts of Wales, Llywydd, where numbers are still very effectively suppressed, and an R level of 1.43 would not be a reflection of the circulation of the virus in those parts of Wales. So a single figure for Wales at the moment is particularly affected by what we have seen in Cynhelir, in RCT, and more latterly in Newport. Nevertheless, the tax summary does suggest that the rate has crept back above 1 in Wales, and it's why we took the measures that we did on Friday of last week to respond on a Wales-wide basis to that emerging picture. The £32 million investment that my colleague Fawn Gethin announced on the 18th of August, Llywydd, will mean 24-hour working in labs in Swansea, in Cardiff and in Rhyl in October, and hot lab capacity more widely in Wales at the moment in November. If we can, of course, draw it forward, we will want to do that. The investment is both a matter of capital investment, but also employing more staff in those laboratories. We had 3,000 applications for the 160 jobs that will be recruited, and interviews for those posts began yesterday. So as soon as we are able to get those people in post, the sooner we will be able to get that lab capacity in active operation here in Wales. And when we have more capacity in that way, we will be able to think again about who we test, when we test them, including, I'm not suggesting that we've made that decision at all, but it will allow us to consider the issue of asymptomatic testing in a different way.
In 6 weeks' time, the UK government's furlough scheme will end, and the looming cliff edge will leave thousands of workers facing the crippling uncertainty of unemployment. If a further rise in COVID cases means local lockdowns will have to be imposed in other areas over the coming months, and if the UK government does not act, does the Welsh government have a contingency plan to offer a local furlough, effectively, as well as financial support to businesses and local public services in the affected areas, as well as those unable to earn because they're self-isolating? I'm sure the First Minister would agree that it would be absolutely wrong to penalise people simply for being ill.
I entirely agree with that point, Llywydd, and it's been made repeatedly by me, by Vaughan Gethin, by the First Minister of Scotland in a call where I joined with her and indeed the First Minister of Northern Ireland in calling on the UK Government not to bring the furlough scheme to a blunt end, to recalibrate it, to recast it, and to add to it an ability to support the wages of those people who we are asking to self-isolate for 14 days. At the moment, there is a perverse incentive for those people who work on very low wages to go into work when you're not feeling well, because otherwise you have to rely on £95 worth of sick pay every week. A simple scheme in which the UK government itself guaranteed the normal wage level of those people, or indeed did it in partnership with employers, would eliminate that perverse incentive. I think it would increase compliance with the rules that keep us all safe, and would be a sensible investment by the UK government, because you would be, in the way we often talk about in this chamber, acting preventatively, rather than having to pick up the costs which follow when that person does go into work, infects other people, leads to greater demand on public services and firms having to stop production and so on. My colleague Ken Skates is at the moment working on the third phase of the Economic Resilience Fund here in Wales. Part of that consideration is the help that we can give to firms who find themselves caught up in local lockdowns here in Wales in future. Will our budget stretch to the income maintenance of people who are affected by the end of the furlough scheme or who need to self-isolate? I'm afraid we're simply not resourced to do that. Income maintenance is not a devolved function to the Welsh Government. Funds don't flow to us from the UK Government to support that, and it's much harder to see how we would be able, in an affordable way, to devise a scheme of the sort that Adam Price rightly draws attention to, but which is equally rightly the responsibility of the UK Government to put in place.
Weinidog Plaid Brexit, Mark Reckless.
First Minister, given the legal requirement to inform the Information Commissioner within 72 hours and his guidance to inform those affected without undue delay, did you and or Public Health Wales sit, I believe, for around 2 weeks on news of this major data leak? Could I also ask you to clarify your version of the rule of 6, which you insist must be different from England's? Why say that these 6 must be of the same extended household, formed of up to 4 households, not including children, but then that these 4 households, although forming an extended household, may not all meet at once if more than 6? Could I also remind you, you previously said there was only a marginal public health case for non-medical face coverings. Your Health Minister said that the Chief Medical Officer for Wales thinks that masks should be a matter of personal choice. What new evidence have you seen to remove that personal choice from people?
Well, with the rule of 6, I don't think is very difficult to follow. What we know is that coronavirus is being passed by people meeting inside each other's houses. That is what lies behind the transmission in Cynhelir. That is what lies behind the transmission in many parts of England. And in order to try to bring the position back under control, what we are proposing in Wales is that no more than 6 people should meet indoors at any one time. It limits the chain of transmission. It really is as simple as that. And when chains of transmission are driving up figures of people suffering from coronavirus in significant parts of Wales, and doing so quite alarmingly, then it is very important that government act to bring that back under control. We have a more liberal regime here in Wales than elsewhere, because 4 households are able to form a single extended household, and that itself provides an umbrella which helps to disrupt chains of transmission, but no more than 6 of those people should meet at any one time. We will allow primary school age children to be part of that household beyond the 6, because of the evidence that those children don't suffer from coronavirus and don't transmit coronavirus in the way that adults do. It's a proportionate attempt to try not to interfere in people's freedoms more than the minimum necessary, but to do the minimum necessary in order to address the escalating numbers of coronavirus that we see in too many parts of Wales. As far as face coverings are concerned, in our local lockdown plan, again published in the middle of August, Llywydd, we said that if the circulation of the virus in Wales moved beyond a certain threshold, we would revisit our advice on face coverings. At the end of last week, the rate in Wales went to 20 per 100,000 of the population and has remained above 20 ever since. 20 is the figure we use to identify foreign countries where if you've been abroad and you have to return to the United Kingdom, you have to self-isolate. It seemed to me to be, again, a proportionate way of marking that unfortunate threshold. And we should ask people in Wales to do that marginal thing, because when you get to circulation of the virus at that level, marginal bits of help that assist us all in keeping it under control and driving it down become worthwhile.
In Sweden, there was no lockdown, as we've discussed before, First Minister, and there has to date been no significant resurgence in the virus. Indeed, we've just lifted travel restrictions on Sweden. Yet in Spain, where there was a very severe lockdown, we are seeing a large resurgence of the virus. What then is the reasoning behind the Welsh Government's strategy of keeping people locked down throughout summer, when people's immune systems are at their strongest and when NHS capacity is its greatest, only to delay increasing infections until we are going into winter? You've locked down my constituents in the Cynhelir council area and even talked about the possibility of curfews and restrictions on alcohol sales as potential measures you may consider. Having taken people's summer away, only for cases to rise again, do you accept that lockdown fatigue has taken hold and that you cannot keep people locked down forever? How much longer do you expect to drag out this pandemic in Wales through your restrictions?
Well, Llywydd, the member often appears to occupy a world that many of the rest of us don't occupy, but now he appears to have a different season in his clock as well. Wales was not locked down during the summer. Our tourism industry has resumed. Our stay local restrictions had been lifted. People have been able to meet in the outdoors. People have been able to meet indoors. It's absolutely nonsensical to say that the summer was lost here in Wales. What has really happened in Wales is that some people, a minority of people in Wales, have taken the summer as a sign that coronavirus was over. And the fact that they have been able to do so much more than they were previously has been read by them as a licence to do even more than was permitted, and we are seeing the results. We are seeing the results in the lives of people who are now suffering from this disease, and I'm afraid that we will see over the weeks to come the impact of that in people being admitted to hospital and call on our ICU beds again. So very far from the Welsh Government denying people freedoms which they should have experienced. We have done our very best to restore freedoms whenever it has been safe to do so. And I am saddened by the fact that at the moment we are faced with a position where the Welsh experience of coronavirus, instead of improving, is worsening. And we may all have to make those efforts again that we made earlier this year, unless we are able to persuade all of those people in the members' constituency and otherwise to act in a way that protects themselves, protects others, and helps us all to keep Wales safe.
Question 3, Mark Isherwood.
What support has the Welsh Government provided to autistic people during the coronavirus pandemic?
The coronavirus crisis has been especially challenging for autistic people. Working with others, the Welsh Government has focused on practical help and specific guidance for those affected. Last month, for example, and jointly with the National Autistic Society, we published advice on face coverings for autistic people on public transport.
Well, the Left Stranded report published last week by the National Autistic Society and its partners shows that as well as significantly exacerbating long-established challenges autistic people face getting suitable social care and educational support, the coronavirus pandemic has had a severely detrimental impact on the mental health of autistic people and their families. How, therefore, will you respond to the report's call for the Welsh Government to create an action plan to protect autistic people and their families in case of a second wave, prioritise the development of the Code of Practice on delivery of autism services, strengthen the legal rights of autistic people and their families in Wales accordingly, publish the Additional Learning Needs Code ahead of moving to the new support system next year, and implement the commitment that all teachers receive mandatory autism training as part of their initial teacher education, alongside rolling out a public awareness campaign on autism, as is happening elsewhere in the UK.
So I thank Mark Ishwood for drawing attention to the left-stranded report, an important report, and I know that the member wrote yesterday to both the Health and Education Ministers drawing their attention to it. As Mark Ishwood has said, there are 3 specific recommendations in the report for the Welsh Government. The first is to develop the Code of Practice on the delivery of autism services, and the Minister for Health and Social Services will issue a written statement shortly before the end of this month, setting out the timetables for consultation and publication of the code. The second recommendation was for the publication of the Additional Learning Needs Code and the implementation of it in 2021. And on the 3rd of September, the Minister for Education announced that the code and the regulations will be laid before the Senedd in February of next year, and that will indeed allow the commencement of the Act and a phased rollout of it from September 2021. And the third recommendation concerns the National Awareness Campaign, to which the member drew attention, and our National Autistic Team and others, including those working in the field of initial teacher training, are working together to raise public awareness of autism in the community as a key theme of our implementation plans.
Helen Mary Jones. Helen Mary Jones.
Diolch, Llywydd. First Minister, you mentioned in your response to Mark Isherwood the code of practice around face coverings for autistic people, and you'll be very aware, I know, that as well as autistic people finding it sometimes difficult to wear a face mask, they can also find it difficult to communicate with somebody who is wearing a face mask, and the same would be true, for example, of deaf people who may need to lip read. Can you confirm this afternoon, First Minister, and I'm asking this question in the context of a constituent who had an issue with this, that if a member of the public, an autistic person or a person with deafness issues, requests a member of staff in a shop to remove their face covering so that that deaf person or autistic person can more effectively communicate with them, that it is acceptable for the member of staff to do that, providing it is possible to maintain 2 metres social distancing. My constituents' experience suggests that there may be some confusion, but on the part of shop staff in this regard.
So I thank Helen Mary Jones for that. I confirm that in the circumstances she has described, it would be acceptable, but we do know that there is quite a lot of learning that the system has to absorb. It was one of the hesitations that the Chief Medical Officer has always expressed about the compulsory use of face coverings, that there have to be exceptions, and we have to be sensitive to those people who, for different reasons, do not find the wearing of a face covering themselves possible, or who find it difficult when others wear them. We will use all the exceptions that we put into place when face coverings were made compulsory on public transport in the new areas that we have made them compulsory as from Monday of this week. And there will, I'm afraid, be a short period in which sensitivity to some of these issues will have to be developed amongst people who haven't had to operate in this way up until now.
Cwestiwn 4, Carwyn Jones.
Llywydd, will the First Minister make a statement on the test, trace and protect strategy for coronavirus?
Thank Carwyn Jones for that question. Llywydd, the performance of our test, trace, protect service is a credit to our health boards and local authorities and has secured strong support from people across Wales. Since the 21st of June, 98% of positive cases and 94% of their close contacts have been successfully contacted and advised.
I thank the First Minister for his answer. There have been some instances of people waiting for results, of course, where they've sought tests. Will the First Minister give me assurance that the Welsh Government is doing all that it can to make sure that, as it's done with Test, Trace and Protect, that it's working hard to ensure that results are made available in good time to those who need the results?
Again, thank the member for that supplementary question and agree with him, of course, about the importance of timely responses to tests that have been conducted. As I said in an answer to an earlier question, with the difficulties that are being experienced in Wales at the moment are the result of the well-identified difficulties in the Lighthouse Lab system, a system which was working very successfully only 3 weeks ago, and which we very much want to see being successful again as rapidly as that is possible. The UK Minister responsible says to us that within 3 weeks that system will be properly back on track and providing timely results to people in Wales and beyond. In the meantime, our own laboratories continue, I think, to provide timely results. 91%, for example, of hospital tests done at Public Health Wales labs are returned within 24 hours. And what we are trying to do with our own capacity is to use the most rapid results where those results are needed in that fashion. So I think, I may have said already, with apologies if I did, that around 99% of tests carried out in the community in Cynhelir are being returned within 24 hours. We need the Lighthouse Labs to be back operating as they were a short number of weeks ago in order to provide the same service to those parts of the system in Wales who depend upon those laboratories as well as our own.
Andrew R.T. Davis.
Thank you, Presiding Officer. First Minister, obviously any test and trace system requires confidence in the sharing of information. You've been asked twice this afternoon about the data breach that occurred in Public Health Wales, a substantial data breach. On the one question that was put to you, you were asked, when did the government get alerted to the fact that this data had gone into the public domain? You failed to answer that question. So could you respond to my question, please, by providing an answer? When was the Welsh Government, not yourself, the Welsh Government, informed of this data breach? And who in the Welsh Government was the first point of contact in the ministerial ranks to be alerted to the fact that 18,000 names had been put in the public domain?
Well, Llywydd, I gave an answer which was within my knowledge. I know when I was informed. I don't know the answer to those other questions, nor would I expect to know them just standing up here in the chamber. We will discover those answers, of course, and I'm very happy to communicate them to the member.
Rhina Piorwerth.
Diolch, Llywydd. Mae'n amlwg i fi bod yna rhywbeth catastroffig wedi mynd o'i le efo'r system brofi yn y bythefnos diwetha. Nid dim ond arafwch canlyniadau yn dod yn ôl ydy hyn. Mae etholwyr i fi, aman rhan eraill o Gymru'n methu cael prawf cartre o gwbl, cael trafferth ffonio 119, yn methu cael slot yn eu canolfan drive-thru leol sy'n llawer rhy bell beth bynnag i lawer y bobl. Dwi'n cytuno'n llwyr efo gwyddonwyr Independent Sage sy'n deud ers misoedd bod na beryg go iawn yn Llywodraeth Cymru yn penderfynu rhoi i ffydd mewn system oedd yn cael ei rhedeg gan Llywodraeth y Deyrnas Unedig, ac mae beth angen oedd datblygu cyfundrefn Gymreig ar gyfer profi. Ydych chi'n gweld rwan mai camgymeriad oedd rhoi ffydd yn y system Brydeinig, a beth sy'n angen ar frys rwan ydy cynyddu'r capacity yma yng Nghymru, capacity mae gennych chi fel Llywodraeth reolaeth dros efo.
Wel, dwi'n cytuno gyda'r aelod, mae problemau yn Lighthouse Labs yn difrifol, a mae'n pwysig i'r Llywodraeth y Deyrnas Unedig i delio gyda'r problemau na mor gyflym a sy'n posibl. Dwi ddim yn cytuno o gwbl da fe, pan oedd neu'n ddweud fel rhan o'r annibyniaeth mae Plaid Cymru bob tro yn trial i awgrymu, a ffordd gorau oedd i bod yn hollol annibynnol yn y maes yma a ddim i defnyddio'r y capacity oedd yna i defnyddio ledled y Deyrnas Unedig. Dydy Llywodraeth yr Alban ddim wedi wneud hynny o gwbl, a oedd e ddim yn wneud synwyr i ni wneud e hefyd. Ac i gweud y gwir, yma ar llawr y cynulliad, dwi'n cofio bobl yn dweud ata fi pam ydych chi ddim yn defnyddio'r capacity sydd gael mewn systemau eraill. So ni wedi defnyddio'r capacity na, ac tan tair wythnos yn ôl, oedd y system na yn gweithio yn dda. Y challenge nawr yw i wneud y gwaith ar lefel y Deyrnas Unedig i roi Lighthouse Labs nôl yn y lle ble oedden nhw nôl y mis Awst. A dyna beth ni'n eisiau cefnogi.
Cwestiwn.
Diolch, Llywydd. Will the First Minister make a statement on the local lockdown introduced in Cynhelir?
Llywydd, the start of last week saw a significant increase of coronavirus cases in the Cynhelir Borough County Council area in absolute terms and as a proportion of people tested. On the 8th of September, following the request by public authorities, ministers introduced measures to control the virus and to protect public health.
Thank the First Minister for his answer. When the lockdown was announced last week, it threw many residents in Cynhelir into confusion, and I was inundated with messages from people who were anxious to find out what effect it would have on their circumstances. It took nearly 24 hours before guidance was published, clarifying whether parents who share custody of their children and live on either side of the county border could see their children, whether bereaved family members could attend funerals, and whether people who were shielding earlier in the year would be asked to do so again. That was 24 hours of unnecessary distress and angst that could have been avoided if the guidelines had been published at the same time as the announcement. Now that areas like Newport and Merthyr are also possibly facing lockdowns, would you, First Minister, please provide a guarantee that detailed guidelines will in future be published as soon as any lockdowns are announced, and that any changes to guidelines are communicated in advance of implementation so that people are given time to prepare?
So I think the question completely fails to understand the context in which such decisions are made. They are not made at a leisurely pace. They're not made with an opportunity to put every single dot and comma in its place before they are announced. You are dealing with a public health emergency. You are dealing with a situation in which a day's delay can put more people's lives at risk. And I say to the member that her constituents and those who I know have contacted the member for Cynhelir, Hefin David, are a good deal more understanding than she appears to be of the fact that the Welsh Government took action immediately we were asked to do so by those public authorities, and within 24 hours, every bit of guidance that was necessary to help people to deal with the changed circumstances was available to them. Now, we wish to get that guidance to people as fast as we possibly can, but the sequence of events cannot be to provide guidance and then to announce. When you're faced with an emergency and you're faced with advice from people on the ground that action needs to be taken as fast as possible in order to protect people's lives, you take the actions first, and then as fast as you can, you provide the guidance to go alongside it. That is what we did in Cynhelir, and that is what, of course, we will aim to do should any similar situations arise in any other parts of Wales. And the people of Cynhelir, who have cooperated fantastically with the restrictions that have been put in place since, I think show a great deal more sense than the member gives them credit for.
Hefin David.
Diolch, Llywydd. As a resident of the Cynhelir constituency, I've seen it firsthand, the sacrifices that people are making and complying with the restrictions in which we're living under, which were very clear in the outset, but have led to some questions from residents with specific scenarios. One I've been dealing with are people who've been required to cancel holidays, pre-booked holidays, and I have to say the travel industry has not responded well, particularly with regard to refunds, although there has been some scope for rebooking. And I have to say EasyJet and Ryanair have been particular standout examples of companies that seem to care little for the health, well-being, and indeed legal obligations of their passengers. And that has been very disappointing. The Welsh Government has done the right thing by writing to the travel industry and the insurance industry with very clear instructions for them, what they need to do to respond to people to meet their legal obligations. The UK Government too now needs to step up and provide support for people who are affected by these circumstances, for those affected passengers. So can I ask the First Minister, has he had a response from the travel industry and the insurance industry? When does he expect to get that response if he hasn't had it so far? And would he also call on the UK Government to take immediate action for those passengers affected?
So I was going to begin by thanking the member and his staff for the enormous efforts I know they have made over the last week to respond to literally thousands of inquiries from Caerphilly residents and for the way that he has taken up issues of this sort on their behalf. He's right, of course, that Vaughan Gethin and Lee Waters wrote ministerially to the Association of British Travel Agents and of British Insurers back on the 10th of September. They said in the letter that it's incumbent on the travel and insurance industries to take the necessary steps to mitigate the financial impact of restrictions on members of the travelling public whose travel plans have been disrupted. We are yet to receive a reply to that letter. My colleague Ken Skates will chair a quadrilateral meeting of ministers later this week who have responsibilities in this areas, and he will certainly be raising these matters with the UK Government as well, because these impacts are not confined to Wales, Llywydd. There are people in many other parts of the United Kingdom who find restrictions imposed locally that have an impact on their ability to fulfil travel plans, that it is not their fault at all that they're in that position, and the industry needs to respond accordingly.
Cwestiwn 62, Lloyd.
Diolch yn fawr, Llywydd. A wnaeth y Prif Weinidog ddatganiad am ailfandio'r dreth cyngor yng Nghymru.
Fawr I Dai Lloyd, mae sylfaen y dreth cyngor ar gyfer Cymru yn fwy gyfredol a chywir nag yw yn Lloegr nac yn yr Alban. Bu Llywodraeth Cymru yn cyhoeddi dogfen yn hwyrach yn y Hydref yn trafod ffyrdd eraill o weithredu yng Nghymru gan cynnwys diwygiadau ac ailfandio.
Diolch yn fawr. I mean, First Minister, you'll be aware that if a property has been improved or extended since it was placed in a council tax band, the Valuation Office reviewed the banding to take account of the alterations when it's sold. However, it is clear that there are problems with the system, with delays experienced in informing residents of changes. Now, constituents of mine last month found out that their council tax banding had jumped 2 bands and are now being asked to pay the additional council tax, around £1,000, backdated to when the property was bought in November 2018. Now, do you agree that this is unfair, and will you agree to look into changing the guidance around the backdating of council tax payments in these circumstances?
Well, Llywydd, can I thank Dr Lloyd for raising this concerning issue. I've seen, as it happens, the letter that he wrote on the 7th of September to Julie James. And I've asked Welsh Government officials to contact him direct if he's happy for that to happen, just to find out a few more details of the cases that lie behind the letter so we can pursue them properly. The information I have is that there is less discretion than in other areas of council tax liability in the law in relation to the sort of rebanding to which Dr Lloyd's letter refers. There is a free appeals process for anybody who feels that the system has not been fairly implemented, and that is to the Valuation Tribunal. But the points that the member raises are concerning ones, and with his permission, we'll pursue them in more detail with him directly, so that we can see whether there is anything we can do to assist.
Finally, Janet Finch-Saunders. Who I can't see. Yeah, I was calling a supplementary. You stick to your job, I'll stick to mine. That was very kindly meant. And that's your questions for this afternoon complete, First Minister.